This episode of Beyond the Tube, Real Stories, Real Advice is proudly brought to you by TubiFun. TubiFun are a fantastic company who endeavour to make tube feeding a little bit more fun for our Tubi kids and their families. Check out TubiFun on Instagram via the link in our show notes. Thanks again to TubiFun for sponsoring today's episode and for your continued support of the Tubi community. Today, we are lucky enough to be joined by Manisha from Uprety, and she is an expert nurse in all things continence and PEG care. She looks after our community with the utmost respect and care, and I think you are going to get a lot out of today's episode. Thanks for joining us, Manisha.
Appreciate you for having me.
Thank you. So before we get cracking into some questions about what it's like to come home with a tube and all of those kinds of things, I would love it if you would tell us a little bit about what a day in the life of Manisha looks like.
Sure. It's definitely very hectic.
I can imagine.
If it's a road day for me, which means driving from one client to another, whether that's elderly client or a paediatric, could be for anything like clinical procedures, whether that's catheter changes, wound cares, PEG cares, the stoma cares. I do that while I also have in conversation with my team in the office if they need any help with the resources and things like that. So that just takes my whole day if I'm on the road.
It sounds very busy, but I also think it sounds very fulfilling.
It is, yeah. I'm very passionate about what I do.
Yeah.
I love nursing. That's the only job I've ever wanted to do, which I'm very blessed that I get to do that every day. So
amazing.
Yeah.
Oh, thank you for all the work that you do.
Thank you.
Appreciate it.
Thank you.
So obviously, Beyond the Tube, we have a pretty high focus on tube feeding kids. I can speak from personal experience, and I guess before I go on to ask the first question, I kind of would like to set the scene a little bit. Ezra was diagnosed failure to thrive and was hospitalised within just like 48 hours of all of this happening. We ended up at our local hospital where they sort of assessed him and went through sort of their protocols and processes, which I'm sure you're somewhat familiar of. And they told us he would need an NG tube to get his weight up. He was 100% breastfed at that time, would not accept a bottle, was not eating any food orally. Interested in food, wanted to touch it, play with it, put it in his mouth, but would not swallow it. So 2 days after on the second day of admission, they told us the NG tube was going in. This was 3 days after his first birthday. We were fine. Like we always assumed it would be temporary. That was definitely the way that they sort of set the scene with us. And I'm sure that's the way they set the scene with most families, because at that time, they probably don't know enough information or don't want anyone to be fretting over the fact that this could be something that becomes permanent. And then we went through the process of, lots of specialists intervening in his care, some from other hospitals. So we were having like virtual appointments with specialists like gastroenterologists, ENTs. We obviously had a pediatrician at the hospital, a dietitian that was going through different types of formula. And then once they felt that they were comfortable with what they thought we knew and what they thought we could handle, they sent us home. So we were only there for about 5.5 days, 5.5 very long days. And I'm very thankful for the care that we received. And we still use that very same dietitian to this day. That's how happy with the care I was. But we were sent home with no information. Wasn't like we were given a
flyer.
Yeah, a quick reference guide. If this happens, do this, or if that happens, do that. We were told we would receive another phone call from a closer hospital to where we live, from their paediatric unit, to sort of set up regular health checks with Ezra to check his weight and his height and, ensure that whilst we were feeding him, he was starting to grow and whatnot. So my question to you is, what would your advice be to parents who maybe are going through a similar situation, or who have been told that their kid is going to be getting a tube in the future and they're trying to prepare for that? What should they be doing? And maybe let's start with an NG tube and then we can talk about
exactly
PEGs and whatnot.
When we talk about discharging, we need to be very confident about why are they discharging?
Yeah.
With what plan, right? When the doctor, specialist, nurses come in the room, you've got your kid in the room with a tube hanging out from your nose, which is usually NG tube, which is usually temporary, right? and you've just been told that you are safe to go home, you'll be fine. With all that confidence boost that the team hospital likes to give, take that in as much as you can, soak it in, all the information they give you, and just say, yep, that's fine, thank you. I'll think and I'll see if I will accept the discharge. Because you need to be really confident and not go with the flow of somebody who's just told you, you can go, you'll be fine, go home and find yourself, oh my God, what am I doing? First thing you can do is sit down, make a note on the side, think about what would you actually do after you are gone home after this. You've got a baby hanging, a tube hanging out of his or her nose. What if the tube comes out? Do you know how to take care of that? What if he starts bleeding? What if as soon as they get home, they start crying? You don't know what's going on.
Yeah.
So all these questions that you run through, if you don't have answer, have it in the notes and feel free to request for a social worker. Say, I really don't feel comfortable going home.
Yeah.
I want more information. I want more training. I'm happy to take the training from the nurses here.
Yeah.
And I want extra support when I get home. I want that all written down in the discharge plan. Get as much as, flyers or the resources that you can grab before you go home, okay? Because you don't want to find yourself at home with a crying baby, bleeding nose, tube pulled out, and you don't know if it's an emergency or not. You don't have to go home right after the doctor's told you that you can take your baby home. Be the advocate for your kid.
Yeah.
Be the loudest voice you can be in the hospital. It doesn't matter. Because if you think you're not ready to go home, you don't go home. You ask for a plan, interim plan.
Yeah.
And what's the plan for future? What's the long-term plan?
And what about when it comes to a PEG? Ezra's got a Mickey button, which obviously is a surgical procedure. It's done under anesthesia. They generally keep you in hospital 24, 48, 72 hours, something like that, depending on how the child responds, how they're healing, all of those kinds of things. So obviously all of those same fundamentals would be the same. But as far as discharge home and information, again, in my experience, was very, very, very little.
Right.
There was some about wound care and stoma care, but there wasn't much about what happens if the tube comes out, what happens if it gets blocked, what happens if, if the balloon bursts. Yeah, that happened too. What do we do with those kinds of things?
So once there is a surgery to place the tube through the abdomen into the stomach, it usually is recommended that you don't touch the stoma for at least 3 to 7 days. That's when after 3 days, that's when you start taking care of stoma. Because that's an open wound, right? So you want to take care of the stoma as if it's a wound.
Yeah.
So it's a proper wound care. It has to be sterile. It needs to be dressed, whatever the doctor tells you to do. It's usually normal saline, betadine paint, and cover it with a sterile split gauze, right?
Yes.
And you place that in. So it is also recommended that you turn the tube clockwise in a full degree, so that there's no crust or there's no sedimentation or any fluid buildup that's going to then start causing dermatitis or any skin issues, because it's an open wound.
Yes.
So you want to keep it clean and dry as much as possible. Up to 7 to 10 days, you do that as a wound care. And after that, it's usually just a normal shower and making sure keeping it dry. If you start seeing any leakages, you apply barrier creams. So what that does is it creates a film, a barrier for getting those fluids around the skin that is already healthy, breaking them down. So it prevents that. Otherwise, information like this is readily available even online. So if you go into Google and just type in how to take care of stoma, that's just been inserted. Pediatrics. It's best even you do that before you leave the hospital, and then you have those kind of information in your hand and run it by the nurses in there or the doctors in there and say, this is what it says, this is what I've read, do you think this is okay? And another thing that you can ask them before you leave the hospital is, do your research, put it in bullet points, taking care of stoma care, right? And run it by them and say, is this okay? And you're full confident that you can take care of the stoma.
Yeah.
You go home because you already have that care plan. You know what to do when the tube comes out. You need to make sure that the tube is inserted back and make that call, because you need to go back to the hospital. You don't want to change tubes by yourself, especially in early days. What if it starts bleeding? What do you do? So you will have that in the care plan. What if the balloon burst? That's one of the reasons the tube comes out.
Yes.
When making that care plan, also having a little supply at home, just in case if you get told, oh, I'll take you through this process because you're very far away from the hospital, the paramedics won't make it on time, you have consumables that you can have handy.
Yes.
They can take you through the process of how to reinsert the peg back in, or stop the bleeding, things like that.
And I think on the back of that, that's a really good point, because probably the biggest thing that was stressed to us, and particularly in those very early few days and weeks of having the peg inserted, was if it comes out, it is an emergency. You've got 60 minutes to get it back in before that stoma will close. And then we're talking another surgery, and of course that would be awful for everybody, for the child, for the parents.
Traumatic.
And it's difficult. My understanding is quite difficult to go back in and reopen that from a surgical perspective. Again, don't quote me on that. I've just heard that can actually be quite difficult. So I think that's a really good point, particularly for people who maybe don't live nearby to a hospital. They may be more than 60 minutes.
Exactly. Like in rural areas.
Yes. What do I do? How do I keep that stoma open until I can get to the hospital?
Make sure you have consumables handy. So if you have a new peg in handy, the old peg has come out, I don't recommend putting the old tube back in. Open a new one, put it back in, and then you deal with it.
Yes.
Because the stoma's not going to close. You've got that enough time.
Yes.
For you to take your child to the hospital, or the paramedics to turn up, or whatever that is. So that is the important part where you need to think of not only care plan, but you need these products handy for emergency situations.
Yes. Yep, absolutely. And I think that that's really, really important to have. I think often surgeons will tell you either leading up to the surgery or even on the day of, this is the type of button that you're getting if it is, or this is the type of tube that you're getting, whatever the case may be. So then you can go onto a reputable provider and go and buy that product again. So you've always got a spare. My advice, the advice that was given to me from Ezra's nurse, was always have at least one spare one. We currently hold 2.
Good.
We did get caught where we didn't have a backup. His balloon burst. We didn't realize it. His button came out in the middle of the night. It was well over 60 minutes that it was out for, and thankfully
it didn't
the
close.
stoma did not close. Oh. Such a relief.
So you have a backup for backup now.
I do. Yes. I do have a backup for the backup because I got caught and I thought I had one and I didn't. We'd used it and I had thought we'd replaced it. It was at a time when we were moving homes and I think it just slipped my mind or potentially got lost in the move. Either, I didn't have it. And as it turns out, really pretty much impossible to get a kit from even our public hospitals. They don't carry them.
No, because they're expensive.
Yeah. Very expensive.
It is lucky that Ezra's got a plan, NDIS plan. So a lot of it will be funded by NDIS. So it's always good to have that funding in there and make use of that. But there are people that are unfortunate and don't get into the scheme for many reasons. If a hospital can't provide you with those supplies, if you're particularly in Central Coast, you were telling me about this non-for-profit organisation that can help.
Yes, Central Coast Kids in Need.
Yeah, so that's for Central Coast. But for viewers that, don't live in Central Coast, they can always look in the area.
Yes.
I'm sure there are many of them out there.
The other thing I think people can use is the HENS program in New South Wales.
Yes, correct. Yeah.
Which I know people get confused with NDIS and HENS, and sometimes they get interchangeably used. They are separate. HENS, I believe, is a state-funded program.
Yes.
And NDIS is a federally funded program.
Correct. So, but then there's a catch. If you are funded by HENS and you have all these supplies, you can't double dip.
No, you
can't double dip.
Yes.
So you need to ensure of that as well. So HENS will provide you with everything, the pump, the machine, the feed. You might have to buy it externally.
Okay.
But all the
tubing and that kind of
and
thing?
everything, yes. Yeah.
So we talked a little bit about stoma care as far as, you know, when the button's inserted and what to look for and how to keep it clean and showering, you know, and washing and those kinds of things. What about if you've got an NG tube, a child with an NG tube, and obviously you get that dermatitis, that terrible irritation. People are always on all the groups I'm in, there's just umpteen amounts of photos shared, you know, they go from one side to the other side and the poor kid's just red, raw, and it just looks, look, we've been there with Ezra, I can completely understand. There's lots of companies that do beautiful designs and things like that. Tubify, our current sponsor, they are advocates for amazing, beautiful taping, which I love. But obviously, no tape is really meant to be on the skin for prolonged periods of time. Do you have any products that you think work really well to you know, if we've got taping on the right side and the left side is highly irritated because it's been, you know, we've had a tube change and we've switched sides. Is there any products that you recommend or anything that parents can do at home to try and reduce the redness and the pain associated?
That's a very common issue with any kind of tubes sitting on your skin, whether that's an NG tube sitting on your face or a PEG tube that is not a button, has a long tube, the long-term one.
Yes.
Naturally, there shouldn't be anything sitting on your skin, right? And we're talking about plastic, silicone tubes that is sitting on your skin. With NG tubes, it is always recommended that you switch sides every day. Like if you have the NG tube coming this way on this side and you've got the tape, don't leave it for so long. So change the side tomorrow morning after shower. Let it breathe as well. So when you're having shower, ensure it is being held and have a proper shower, wash your face with whatever soap is suitable for your skin. It is best if you apply barrier creams because that creates that film, especially if you're going to apply tapes because they are irritant to your skin. And face is the most sensible part, one of the most sensible part of the body if you compare it to the abdomen. And it all goes with the same, like you can do the same care for the PEG tube as well when we're talking about NG tube. Just ensuring, like keeping on top of symptoms. So if you start seeing your baby or your kid is scratching, you see redness and, you know, bleeding, then that means that part of the skin is irritated by whether that's tube sitting in for so long or there's some leakages that can happen. So the fluids coming out of the tube, a little bit of bleeding. You make sure you just wash it, dry it, keep it dry. But because NG tube is temporary, you know, that's something that shouldn't be a long-term problem.
Yes, that's right. Obviously, in our experience, it was not the case. Ezra had his for 16 months. So it was a very, very, very long time of highly irritated skin. But I never even thought about switching. Like even if it was in the right nostril, bringing it under and taping it on the other.
Exactly.
What a great suggestion.
Thanks. So that also is because you're not only switching side for giving one side of the face rest or the skin rest. It also does work for pressure area. Because a lot of people don't realize that you can develop pressure area or pressure injuries due to the PEG being on, you know, sitting on in a location for a long time. So people can get that dermatitis, pressure injury mixed together. So to relieve that pressure, that's another way you deal with that as well.
And I guess as far as taping it and keeping it secure, you would probably, if the tube was in the right nostril and you were moving it to the left side for the next day, you'd probably just have a little bit of tape that would go like maybe at the bottom of the left nostril, not covering the nostril obviously, but just to hold it in place so it doesn't move.
That is right. But then again, you need to keep in mind what's comfortable for your kid. Your kid might be saying that's not comfortable. You know? So just ensuring while you are making a route for that comfortableness, just check with the kid. Do you feel comfortable? Do you have any trouble breathing? Because sometimes the tube can sit anywhere and the hole might be blocked, you know? So there's a lot of things that you need to keep in mind.
And I guess once you position it, then you can flush it with water to make sure there's nothing blocked or stuck.
You want to make sure, every time you feed, there's a flush before feed. There's a flush after feed. There's flush before and after medication. Making sure there's no residue.
Residue. I'm talking about.
residues left in the tube because that can disintegrate the tube. So yeah, make sure you do your flushes as well.
What's your stance on parents learning to insert NG tubes or maybe the buttons themselves or any other kind of peg?
I think it is good because obviously we have to save that traffic in hospitals, right?
Yes. Yep.
But then by saying that, I also want to stress this information in the community with especially parents dealing with pegs and NG tubes at home. They do have an option.
Yes.
They do have an option to go to the hospital for changes, especially in the interim days, and be confident to do it at home. You don't need to necessarily do it at home when the hospital have said, oh, no, it is safe to do at home.
Yes.
Until and unless you feel confident, you can go back to the hospital, because it's you who's changing it.
Yes.
And if you're not confident of the procedure, if anything goes wrong in between, then what are you going to do? That's another troubleshooting. So you need to be confident on the procedure of changing, and then you say, yes, I'm confident I can do that at home. But until then, I'm coming to the hospital. Teach me, I want to learn. And put it in the notes. Make your own care plans.
Yes.
That's what we do in the community. We call this in Uprety Home Care bedside training and care plan.
Okay.
So what this is it's a piece of paper, a document. It is called a care plan. A care plan can be against any complex care or high intensity supports.
Okay.
So in this case, we call this a PEG care plan and bedside training. So what we do in this is the kid can be at home or in a group home or wherever. We gather the child who's got the PEG tube or the NG tube. We have their parents, family members, whoever they're being looked after by, whether that's support workers or carers or grandparents.
Yeah.
They're involved, and the nurses there providing that training to all of them in the room, also inclusive of the participant, and saying what is PEG, what's its purpose, what to look for, how to take care of the stoma, and troubleshooting.
Yes.
So that's called the bedside training. And then all that information that's been provided on that day is in a piece of paper, which is called a PEG care plan.
Okay.
So we provide that. So we do this all the time to whether it's a kid or it's an adult.
I'm just thinking two things right now. One is amazing, and how helpful that would have been for us in both instances with the NG tube, but also the PEG that he currently has. That was been so good in the early days to have someone come out and actually put it in paper and put it in writing. And as it happens, my husband and I are going away over to New Zealand we'll be there in 2 weeks. So Ezra is going to be cared for by his support worker and by my mum and my husband's mum. So something like that, which is a step-by-step guide on what to do if this happens, or, this is what to look for in his stoma if it becomes irritating. It's probably not so much for his support worker given her clinical background, but definitely for my mum and my husband's mum, who have a lot of experience now dealing with this, but not with the unusual things, not with the things that we don't expect to have happen.
Troubleshooting points.
Yes. I also think two other prongs that are coming off this. One, travel, and just hopping back to where you said it is beneficial for parents to learn. I know there are a lot of parents out there that are uncomfortable, and I also know that there's often one medical parent. So there's one parent, and that is their job, is the medical stuff, and the other parent doesn't tend to be as involved. I'm not saying they're not involved, but they tend not to be as involved.
Yeah.
But in a case of an emergency, as we discussed, particularly if you live in a rural or remote area, but also if you're traveling, if something happens and you maybe don't have access to a hospital, you might be traveling to a second or third world country. We Australians love traveling to countries like that, which I think is great. But when you've got a tubie, you need to know how to replace that. But also, if you've got that information, if you've got your plan, then you can take that to the hospital if you do need to go and be like, here's everything. This is how much water's in his balloon.
Absolutely.
This is what type of peg it is. Here's the kit. I can help because I know what I'm doing, but maybe I'm not confident doing it, whilst I'm traveling, or I just want to make sure it's done correctly, but you've got some understanding of how to do it. So it's not just this something that somebody else does.
Yeah.
And it doesn't mean that you have to do it, as you said.
Exactly.
You can go to the hospital and say, please support me through this.
Yeah.
I need some help. I want to learn again. Or, it's 6 months in between changes at its maximum for a Mickey button. It's a long time between drinks. You tend to forget what you had to do and how you have to do it. The other thing I'm thinking is this incredible plan would be a wonderful resource to have in our HEBA app, which we were talking about just before. And everybody out there, hopefully you've seen that episode.
I've already downloaded it.
I appreciate that because this is what the app is designed for, so that when an emergency happens, what if we're not at home?
Exactly.
And we don't have that piece of paper, but we've always got our phone with us. We're always traveling with our phones.
But what if you have the paper and you've just accidentally spilled a drink?
That's right. That happens. Or the kid takes it and starts ripping it. Exactly.
Oh, what's this?
Yeah, I don't know what that is. Eats it.
But it's handy. Coming back to like traveling and all that, or respite.
Yes.
It's great. Some people are really blessed to have carers that have a medical background, who are nurses and have retired and now are caring, right?
Yes.
Working as a support worker. That's great.
Yeah.
It's very good to have, but we all get sick when it's inconvenient time. So what if that person has to then sort of like hand over that care while he's still in respite?
Yes.
And he's being looked after by somebody who's never looked after Israel.
That's right.
Then they can just go look at the piece of paper, which is the care plan, and they go, okay, this is the flush that we need to give him before, after food, or this and that, this kind of feed he has, what time he has his feed. His balloon doesn't look like, migrated or whatever. So you need to make sure it's integrated. So you need to make sure you do that flush to check he's got 5 or 10 mils in the balloon, right?
Yes.
So all that information is there. Oh, there's a leakage in the stoma area. What do I do? And it is very personalized care plan. It is only for that person. So you can go, okay, this is the direction by the nurse.
Yeah.
This is what I'm going to do. You don't need to cross-check that going, oh, this is a generic care plan, but will this suit for this participant? You don't need to worry about that.
Yes.
It is a personalized care plan that you have it handy. And especially the app that you said, HEBA.
Yeah. Yes.
It's great to have. Like, you just need to open the app and go, okay, pet care plan.
Which is amazing, and it's easily shareable too, as we were talking about before. You can share that plan. So if it's on my app, I can share the app with you. I can share it with his support worker. I can share it with family. Or if I don't want them to have full access, if I want you to see everything, I can just share the documents that you need with you. Yeah. I go to the hospital, they need something, I can just share that document with them. I can PDF it to them. It's very easy. AirDrop it, whatever. Yeah. Like it's pretty incredible rather than, I've got this chunky folder that I was carrying around. Yeah. No more of that. Yeah. It's all going around in an app instead. And something like this would be incredible to have as a portable document, which of course you could do as well via email and things like that. That's of course another option. But then you've got to remember, where did I save that in my email? Or you've got to go looking for it.
For the keywords.
That's right. That's right. That's right. You've got to go looking for it. I would also love to just ask you a little bit about continence, because I know that you've got so much experience in that space and you're very passionate about it. Obviously, a lot of our tubey kids, as you would be well aware, have multiple issues going. There's multiple things going. It's not just one thing. If it was just one thing, that'd be lovely, but it's generally not.
It's not, yeah.
There's often a lot of things going on. When parents are obviously going through this journey, I hate using that word, but it really is a journey. How do they look out for things that, particularly for young kids, Ezra's not quite 4 yet. He won't be 4 till November. He's only just very slowly starting to toilet train, quite delayed in that aspect. How do parents know if what they're experiencing with their child is normal? Like, is that normal toddler behavior? Is that normal for toilet training? Is that, or do they need more support? Is it caused by something like Ezra's got low muscle tone? So that's often for him, I believe that's what is causing the delay in continence, because his muscles are not fully developed and not working properly. How do people recognize that? How do they get support? Can they get NDIS support when it's a toddler? What does that look like?
So, as you said before, in between parents, there's one medical and the other one's non-medical.
Yes.
You are medical in your
Yes.
team. Not everyone is. Not
Yes.
either can be. Like
Yeah,
it might be
course.
both of them are non-medical
Yeah.
and can't be, right?
Yeah.
You can always. So somebody with PEG or any kind of tube,
Mm-hmm.
you got to remember anything that you put from your mouth that goes in your tummy has to come out.
Yes.
Right?
Yes.
So if there's any issues that you are thinking that's not right, I don't think that's right, you should be able to get that looked at by a professional. When it comes to the exit part, it's called continence, right? So having control of your bladder or bowels or toilet trained or not, right? So usually when participants have PEG care included in their plan,
Yes.
they should be able to access continence
Okay.
easily. All you need to do is ensure that you provide that information right from the start, especially for a kid that has just started PEG feed or feed that goes directly into their stomach or directly into their small intestine. The tummy is still trying to adjust, right? You might have bowel motion that is like really loose diarrhea. That could be because it's new, and that could be because it's just trying to set your bowel. But you don't know if that's going to be a short-term problem or a long-term problem, okay? If you have a coordinator, if you have a lack, you can let them know that this is a problem. I would like a continence nurse to come in and do this assessment because I wanna make sure we get this under control. We want to manage this before it gets worse.
Yeah.
You can get your kid a continence assessment, especially when they have PEGs.
Okay, that's really good. That's really helpful. I didn't know that. So I've just learned something. That's really good to know. Obviously, we know, but I would like to share it with everybody else that you operate in Sydney, Central Coast and Newcastle.
Yes.
So anyone in those areas, you obviously know now, you can contact Manisha and her team and they can obviously support you at any point through this process. It doesn't have to be someone who's just had had a PEG recently or has just had an NG tube. You may have had something for a long period of time.
Absolutely.
And you can they can get in contact with you to organise a continence assistance assessment, or they can contact you to get a plan in place for the whatever tube feed it might be.
Yes.
Is there anything else that you do in your business that may assist kids with anything other than what we've talked about?
We do a lot of things like when we do continence assessments, we find that they're bedwetting.
Okay.
Or they're simply very scared of going and sitting in the toilet. There can be a lot of things, especially for kids that have been diagnosed with ASDs, whatever level, ADHDs, a lot of disability diagnoses. We have intervened, especially in the continence area, by referring them to whether that's a psychologist or a psychiatrist. A kid might be, bedwetting, very scared to sit on the toilet too. Even we never want to. We know any other anatomical issues, but wants to wear pads. But then we've realised it's because it's a trauma response. Yeah. They might have had a very bad trauma. It could be any kind of traumas. So when we realize things like that, we escalate that and we go, okay, they need to see a psychologist or a psychiatrist, or a BSP needs to be involved.
Is there more of you outside of obviously anyone who lives inside these areas that we've talked about, Sydney, Central Coast, they can come straight to you, which is amazing. I know we've got people who are on the South Coast. I know we've got people in other parts of Australia. We've got people all over the world.
Exactly.
If we're on Mr. Google, who are we looking for? What are we typing in?
Type in PEG nurses, training for PEG care.
Okay.
There are a lot of like us. Like it's not only us, we want to be everywhere, but we can't be.
Yes.
But that's when you use Google, and I can assure you there are a lot of providers out there.
Yes.
When you type in and you get these numbers, you call.
Yeah.
Most of us will tell you we can't service this area, but I know this person.
Okay.
They will always have contacts to pass on to. So
excellent.
Definitely, there's many out there.
That's good. I think that's useful, practical information that people can use to find somebody, because, if I rewind to when we first got the NG tube for Ezra, having this would have been
Life-changing. Yeah.
Like really would have.
Yeah.
Because there's a lot of aspects to Ezra's care at that time. We did not have a support worker. We did not have an NDIS plan. That came, 6 months down the track. That was a long way down in the scheme of things. When you're talking about a life-changing event, it was a long way down the track. So it was myself, it was my 2 older kids who are teenagers now, but at the time were not. They were, 10 and 14. Yeah. They had to learn how to feed him through an NG tube. My mother-in-law, my mum, my husband, we all had to learn
how to feed
him.
But then it's not, once you have that tube going into your tummy, it's not only about feeding.
No. There's so much going on.
There's so many things you need to think about. Yeah. The risks of aspiration.
Yes.
You need to ensure your kid needs to be upright, at least 30 degrees.
Yes.
You need to look for the residue that we talked about before.
Yes.
Flushes are so important.
Yep.
Crush your medications really well.
Yep.
Don't leave any food or any medications in the tube.
Yep. Absolutely.
Sitting there.
Yep.
Look for the stomatas. Make sure the stomas are cleaned every day.
Yes.
Dry. Apply of, gauzes in there.
Yeah.
Check for leakages. Check for migration, because that's an indication of, is there anything wrong with the balloon?
Yeah. Something might not be right.
Exactly. So when it comes to tubes, it's not just about feeding.
Yes.
It's about a lot of other things.
And I also think the other thing we tend to forget is children are growing. I mean, that's ultimately why they get these tubes, is generally because there's some lacking in nutrients or growth.
Exactly. It is mainly done for nutrition, hydration, and medication.
There you go.
And that all makes you help grow.
Yes.
Yeah.
So as we're growing, the length of our tube might change.
Exactly.
With an NG. The stem of our Mickey button might change. So there are changes potentially. So if something's happening at those sites, if something's changing, it's often an indication something has shifted. But what is it? It may be that the child's grown. That tube is now too short. We need a longer tube. Ezra had so many tube changes that it was measured all the time.
Yeah.
So, we always knew what length it was at because we had so many. But some kids, don't pull them. There may be medical reasons why they cannot pull them, because they may not be able to, physically be able to do it. So in that case, it really is up to the parent or the carer to assure that that is still the correct length, even if it's been in for, many weeks, or even, I think it can be in there for like 8 weeks or something, that it can stay one tube, for my memory serves me correctly.
6 to 8.
Yeah. So you could grow in that time.
Exactly.
And that may not be right. So then those indications.
And the kids grow faster than us.
They do. Yes. Lucky them. My growing up days are over. Maybe the growing out days aren't. Thank you so much for listening and watching today's episode, and a big thanks to Manisha for joining us on today's episode. I really hope you were able to get something out of this. And if you're new to the tube feeding journey, you know where to go now. All the information for Manisha is linked in our show notes below. So jump online to her website, follow on socials, and reach out if you do need support. I personally will be doing it as well. Until the next time, stay safe, and we'll see you soon. A big thank you once again to To Be Fun for their sponsorship of today's episode. Please head over to their Instagram page and check out their wonderful products. Alternatively, you can jump onto their website. Their link is in our show notes. Without the sponsorship of companies like To Be Fun, this podcast isn't possible. So thank you again, To Be Fun.